Okay, so part 2. We are approximately about 21 hours after my surgery. So basically this is the ACL reconstruction surgery that I did yesterday. I remember in my first video I mentioned that there was absolutely no physical pain. Well, about 12 hours after the surgery, the pain started to intensify. It's more on my left side, this area. I'm not sure if they did something to this place, because I did mention that I have a bit of a pain in the back of the calf, so they might have done a bit of work over there, so it hurts. It started to hurt about 12 hours after the surgery. I had to take some aspirin, or Panadol you call it. Yeah. So the two most important things: take your medicines, take your antibiotics if they gave you, and the painkillers. Now the other thing that I've been exploring on my wound a bit, I noticed some little scarring here. I'm not sure if this is where they, looks like some marks that I got while they were trying to take the graft. But then I noticed something else on the left hand side, on the right hand side, which is like one wound here, so I'm not sure what it means. I don't know, I'll probably have to ask the doctor tomorrow and see what he says. Otherwise, certain activities, there's some pain here. It's like it's movement on a very thin tendon, so it kind of hurts. It's like a sharp pain inside whenever you try to do certain moves that require the muscles to be activated there. Otherwise, there's not much pain anywhere else except when you try to do the physio that the doctors recommend. So on the left leg it would look like this: push down on your knee, tighten your muscles here. When you do the same here, I can't do much. The pain is over here. A dull pain on the lower area near the meniscus. This is probably where they did the operation, and I can't do much. This is about the maximum that I can do. I can't even show you. But the doctor recommends that, rather the physio recommends that you do this kind of activities daily until you gain strength here. Then you can do more. But yesterday it was worse. Now it's about 21 hours. I can push it down a bit more and hold it there for 10-15 seconds, but that's about it. So I can't show you, but you have to try it if you have an ACL surgery done. These are the few exercises that you have to do right after you finish your op, maybe one day. Yeah, and so tomorrow I'm going back to the doctors for a review, and probably will remove this strap. There's not much icing that I can do at this moment in time. I put an ice pack here. It doesn't feel cold at all, so it doesn't work. So the only thing I can do is to elevate my knee, and that's about it. Yeah, so we'll see again after tomorrow then. Yep.